perfect. Thank you. Good morning, Josh.
Hey, Annie, how are you?
I'm good, thanks. We're just waiting for the other commissioners to join.
Great. We were all together a moment ago, and Dave just had to go get a cup of coffee. Well, we were together virtually. We weren't in the same space, but
Okay, sounds good.
as much as I would like that. But how are you doing?
I'm good, thank you.
Good. How's your mom?
Doing good. Got a big test this week, so we'll see how that goes.
Well, all the best.
Thank you. Looks like Dave joined us. So we're just waiting for Juan. Good morning, Dave.
Good morning.
Oh, looks like Juanita might have a conflict. Yeah, I'm thinking Juanita is in another meeting.
Okay. Well, it's just.
Oh, nope, there she is.
Yes, okay. Hey, well.
Sorry, everyone. I needed to get some coffee.
That's okay. I saw a conflict on your calendar, so I wasn't sure if you were going to be here or not. So.
Oh yeah, the Invest Health webinar, but that's recorded. I can catch that.
Okay.
Great.
Josh?
Well, yeah, you want to do roll call, Annie?
Most certainly.
Excellent.
Myself, Annie Cathy, Allison Franz, Casey Gannon, Catherine Schmidt, Chris Lounsbury, David Strohmeyer, David Wall, Eric Dixon, Aaron Couts, Jason Emery, Jen Kircher, Caitlin Germain, John Hart, John Stegmeyer, Josh Lotnick, Juanita Vero, Kate Divino, sorry, Katie, Kristen Jordan, Kylo Lentz, Kylie Paul, Laura Lindquist, Martin Kidston, Nancy Rattel, and Nicole Rush. And somebody else joined up here, Patrick Brigman.
Great.
Did I miss anybody out there? Okay, Josh.
Great. Thanks a lot, Annie. Before we dive in, do we have any public comment on items not on the agenda? Please feel free to comment away. All right, seeing none, we'll jump right to our action items. And our first presenter is Nicole Rush.
Good morning. So these items are grant contracts with the BSTF program for Silixa. Silixa is the company that's making really cool improvements to fiber optic cables. If you remember their presentation way back in June, they were awarded a grant to create 5 jobs in year 1 and another 5 jobs in year 2.
Fantastic. How are things going?
going okay for them. I know that they're a little concerned about the broadband access at their current location out on West Broadway, but otherwise they're proceeding with their hiring plans and are doing well. So.
Good.
I saw
Okay.
Andrew pop. Did he have a question? No? Oh, you're muted, Andrew.
Oh, I'm sorry. I just got here late. I was messing with my Wi-Fi. It wasn't working this morning, so I just popped on. Sorry.
Okay.
More
Well,
broad
you're messing with your wife or your Wi-Fi. It was.
Okay.
Okay.
I move to sign the contract 1-21-03 with Montana Commerce. Am I reading the right one? Yes.
Yeah.
For the board to approve and sign business assistance agreement and management plan agreement with Silixa.
Great.
Second.
All in favor?
Aye.
Aye.
Thanks, Nicole.
Thank you. Have a great day.
Thank
2. All right,
Yeah.
Eric. Talk
All right,
Lurch
yes.
Lane.
Yes, good morning. So you may recall that for the past couple of years, we had some increasing water problems on Lurch Lane and Ola Drive out in East Missoula. And we just couldn't figure out where it was going or actually where it's coming from or what the best way to deal with it was. So we solicited quotes for engineering services to examine the situation and propose some mitigation plans. WGM Group provided the best proposal with the fee associated, and unfortunately, it took a long time getting this put together. With WGM working remotely, we had a lot of miscommunications about getting the contract together, but they did complete the work earlier this spring. At least the initial portion of it. Part 2 is to provide some observation next year and make sure that the proposals that they offered and the improvements that we installed will continue to work. So unfortunately, we're better than halfway through this project and don't have a signed contract, but WGM was aware of the risk of working in that situation, and at this point we do have everything ready, completed, so we just have one more season of observation to make sure our project is successful. So we would recommend that the contract be executed.
Where was the water going?
Well, a lot of it was going down Lurch Lane and into driveways and garages, but we could not figure out where it was coming from. We don't know what conditions up on the hillside changed, and actually this year, for all the times that I was out there, the water did not seem to be flowing as it had the past 2 years. So I don't know if that was an unseasonable year this year, or if we're going back to base conditions from 5 years ago, or if it was just an off year and next year we can expect more. But it was just very challenging to figure out where the water was coming from and why it was different.
It was this spring's earthquake.
Oh, I hope so. That was
Maybe so.
Maybe that shifted something just enough. And the funny thing is, it comes from. We think that some of the source comes from Judge Dayshaw's property up there, and he was out there with Robin Myland last year, one of our road supervisors, and he said he'd been up there for years, of course, and he didn't see any conditions change. It wasn't from a diversion of an irrigation ditch. It was just a ground source spring that apparently seemed to increase production for some reason.
It was Judge Dayshaw excessively flushing his toilet up the slope, perhaps. I don't know.
We could send him a bill for the asphalt.
Eric, have we conveyed any of the property owners along Lurch Lane that were working on this?
Yes, WGM went door to door.
Oh, great.
And so they did that partially to see if they could get background information for the improvements that we placed on Ola Drive. We sent letters before the work was done. So yes, everyone's been well informed, I hope.
Thanks. Well, I would move that we approve the PSA with WGM.
Second.
All in favor?
Aye.
Aye.
Great. Thank you, Eric.
Great,
Thanks.
thank you.
All right, Jason Emery will talk website hosting.
Morning.
Hey there.
This contract. So we've been using a product for a lot of years called Vision Internet to host our website. It was acquired a few years ago by Granicus, which is a large government software vendor. And in the past, we've always hosted that site internally, but they're moving away from that model. And we're actually noticing some of the pain with that, in that we don't get the updates at the same pace that the hosted services have, as they're starting to phase this out. What this does for us, unfortunately, is it limits our ability to keep the site fresh and makes it harder for folks to keep things updated. So this would be a new contract to go ahead and migrate our website to a hosted service that they would host, and also add their developer tools, which will allow our team a lot more flexibility in adapting the site to county needs. One thing that we're also noticing is our pretty rigid, and it doesn't always meet the needs of a lot of our departments, especially when they need to be agile and move very quickly. In the case of the health department during COVID would be a good example of that. So the developer tools will give us a lot more capability to use that site and not have to go out and look for other services, which are, of course, are additional costs and times and things like that. So with your approval, we'll go ahead and get moving on that, and hopefully over the next month or two, get that migrated out to Granicus and move forward with a little more modern website.
Sounds really good.
I move to the chair sign the contract with Granicus.
Second.
All in favor?
Aye.
Thanks, Jason.
Thank you.
Hey, Jason, just real quick. This is Allison.
Yep.
Does this include any sort of redesign, refresh of the current website?
Nope. No,
Okay.
That's kind of a little bigger deal. My thought would be we would be able to, once we get a little more comfortable with, well, first we have to migrate the site. Once we're a little more comfortable with the tools and kind of figure out what options they truly give us, then I thought we could sit down with your team and a few other, especially the heavy user departments, and look at maybe a minor refresh and getting the site a little more updated. I think long-term, we'll have to look at probably making a big project out of a full refresh, and probably engage with some design services to do that, but we really don't have the capacity. So ideally, this would give us some breathing room for the next, I'm hoping, couple years until things settle down a little bit, and then we can look at kind of the overall modernization.
Great, sounds good. Thank you.
You bet.
All right. Adrian Beck.
So I'm pitch hitting for Adrian today, who is not available. So as you know, she mentioned last week that this week you would have before you a request to proclaim the end of fire season for Missoula County. As you can see, we've had some wet weather, which has certainly helped with our conditions and lowered the fire danger significantly in Missoula County to the point where we believe local resources would now be able to contain anything should there be an event. So at this time, we're just asking again for a proclamation to end that state of emergency that's existed related to wildfires as those local resources have become more available. And of course, our weather conditions have changed.
Sounds good.
Sounds prudent. I would move that we approve the proclamation to end the state of emergency in Missoula County due to wildfire.
Second.
All right, all in favor?
Aye.
Thank you.
No more
Commissioner.
fires.
No more fires.
On the seismic activity. All right. Thanks, Chris. Chantel.
Chantel's not here today. Her item is being postponed until October 22nd's admin.
Well, that makes it easy.
All right.
John Stegmeyer.
Hi, good morning, everyone. I'm looking for your approval to submit a grant application for CDBG planning funds. This is a project we've been working on and trying to put together a funding package to fund a countywide trails plan. So we've made some good headway getting funding from the MPO using some of the planning funds. Those are committed to us. We expect that this project for consulting will be around 100,000, give or take. So what we're looking to do is pair the $70,000 in MPO funds with this $30,000 of CDBG grant funds. And then we will supply, we're required by the CDBG grant to put in a little local match. So we'll supply some of our program funds for consulting services.
Great. John, when do you, so if the grant goes through, would you guys RFP this project?
We will, yeah. And I think, either way, we'll likely try to keep going this year with the project. But if we get the grant from the state, we'll likely be producing the RFP in December and sending it out right in the first of the new year. So yeah, it's full speed ahead right now. And we're really excited about those MPO funds because of course that's a significant chunk of money. And hopefully that goes a long ways in conveying the support in our community and from other agencies with this state grant as well.
That's great. Good.
Yeah,
Thanks.
Great to hear. I'm excited for some movement. So I moved to approve the application for CDBG funds through the state of Montana to cover consulting services. To produce a Missoula County shared use path plan, finally.
Yeah. All right, all in favor?
Aye.
Right. Thank you, John.
Yeah, and special thanks to Annie for helping me get those to you guys this morning. It's been it's kind of a last minute notification on that grant, and Annie's been super helpful. So thank you, Annie.
Yeah, well done, Annie.
You're very welcome.
All right, Kristen Jordan, we're some more action here on the mobile crisis unit.
Yeah, this one should be pretty easy. So this is just a request to ask the chair to sign the contract between Missoula County and the state, who is providing $125,000 for us to throw at the mobile crisis team, of which we are with the city providing $125,000 match. So I just as a quick reminder, we put that out for RFP, and the city fire department got the RFP and they're rolling. They're planning on having teams on the ground this week. So they're moving faster than the bureaucracy is, which is great. But yeah, this should be a pretty simple, straightforward, just contract signature. I'm not sure if there's any questions about anything related to it.
It's the fire department teaming up with PHC.
They are, yep. So the fire department has hired PHC as a third-party contractor to provide the mental health professionals for the mobile crisis teams. So it's going to be a pretty dynamic duo, I think.
Yeah.
And starting this week, or have they already been?
They've been planning to start this week. So they've had a really tight timeline. They got the money or the award about 6 weeks ago and have had to throw together a program. But Assistant Chief Brad Davis from City Fire is amazing, and working with some other amazing people, they're getting it done. So it's pretty cool.
Great to hear.
I imagine I will get to see them in action outside my window.
Uh-oh. Well, let's actually, let's hope so. Let's
yeah,
hope
I'm
so.
excited.
Yeah.
That's a front row seat at for this sort of thing.
Yeah.
Great. I would move that we authorize the chair to sign the contract.
Second.
Great. All in favor?
Aye.
Aye.
Thanks, Kristen.
Great. Thank you.
Jen.
Hi, good morning. I'm here to request that the board and chair sign our DPHHS task order for the health department to provide the maternal child block grant to our county for the state's fiscal year. And then this block grant allows us to serve that pregnant women, families with children in Missoula County, and also to participate in our FICMR, Fetal Infant Child Maternal Mortality Review Committee. And so what we do there is we have a lead nurse assigned to that. And we have a task force across Missoula County that reviews all the deaths for pregnant women and fetal deaths and children deaths as well. And then we come up with a prevention plan. If we see if there's a theme across some of the deaths, we come up with a prevention project we work on that fiscal year. So this block grant enables us to do all of those things.
Great.
Yeah, fantastic. And what trends have we seen in the past?
This year and moving on for next fiscal year, we're focusing on safe sleep. So we've chosen this safe sleep and crib for kids ambassador training, and we're all service care providers as well as babysitters and grandparents. So COVID kind of put a wrench in some of our plans, but we're still moving forward with them. And then the year previously, we did safe baby wearing. So some babies were having issues in baby slings not being in there appropriately. So we did a prevention project on that as well. So.
Great.
Thank you. Yes, I move the chair sign the professional services agreement offered by St. Pat's.
Second.
All in favor?
Aye.
Thanks.
Oh, I'm sorry. Did I do the wrong one? I did.
By the DPHHS, the task
Yeah,
order.
Sorry, I was reading 9. Okay, I move that the board approve that Josh signed the DPHHS task order for Missoula City County Health Department for the maternal child health block grant. Sorry.
Second.
All right. All in favor?
Aye.
Aye. That means Kate doesn't have to do anything.
Thank you, guys.
Anyway. Tell us
Thanks,
about
Ed.
the Hatch program.
Thank you.
Hi, good morning. Yeah, I don't have to do anything. You just approved it, right? This next agreement is our annual recurring agreement with St. Patrick Hospital to provide the CATCH program to Missoula County. CATCH is the Coordinated Approach to Child Health program. It's an evidence-based coordinated school health program designed to promote physical activity and healthy food choices, as well as prevent tobacco use in children through preschool through grade 8. And we provide this program in partnership with St. Patrick Hospital to our community. This program was kind of put on hold at the start of COVID, and our coordinator is now back focusing on this program, in addition to spending a lot of her time as our safety officer in our incident management team. But we are looking forward to getting going with this since it's the start of the school year and a good time to be looking at reaching kids in a new way, virtually a lot of the time.
So what's that look like? I mean, she's just setting up appointments with individual kids, or how's that work?
So the way that this program works is it's a train the trainer program, and it is an evidence-based national program, and they have set curriculum. And what our coordinator has been doing is working with the national office to develop some virtual trainings. And the types of folks that would be trained would be like gym teachers, classroom teachers. They implement this program in after-school programs as well. And so what she's been focusing on is reaching out to her contacts, some teachers, principals, other administrators, and trying to really identify what their needs are and what would be helpful for them, and then working with the national office to develop some new curriculum and put some curriculum that is existing into a virtual format.
Got it. Thank you. I didn't realize train the trainer. Okay.
Yeah.
Okay, I'd move that we authorize the chair to sign the PSA with St. Pat's.
Second.
All in favor?
Aye.
Great. Thanks. And you have another one, Kate.
I do. Yes. Two in one here. This next one is a request to approve another annual contract, which is our contract with DPHHS to deliver the WIC program to residents of Missoula County. This agreement also provides funding for our WIC breastfeeding peer counselor program. In Missoula right now, we're serving about 1,450 individuals with our WIC program. Participation has been declining following national and state trends, and that trend has continued through into the COVID-19 pandemic. We've lost about
Oops, she froze on my end.
Froze up. Yeah.
I shut my camera off.
Okay.
Yeah.
Sorry, we're having internet problems at our house and are getting new internet service from a different provider tomorrow. So hopefully that will solve this problem.
Last we heard was numbers were down, and then it kind of trailed off.
Okay. So numbers have been down about, we lost about 200 participants since March, since the start of the pandemic. And that is following trends, so it's nothing new. We are seeing new participants every day, but retention has been a challenge. We are currently benefiting from two very important USDA waivers that allow WIC to provide services remotely. I won't get into the details of what those are, but we've really benefited from that, and we're able to complete the entire participant appointment over the phone right now. And that remote service has been really beneficial for our clients as well as our staff in keeping everybody safe. So that's kind of where we are with WIC right now in our county.
Great. Well, I move that the chair sign the DPHS task order for the WIC program.
That.
All right, all in favor?
Aye.
Aye. Thanks, Kate.
Thank you.
Right, Nancy, looks like you got a couple of them.
I do indeed. Hello, everyone. Nancy Rattel, Grants Administrator through the Community and Planning Services Department. So yes, item number 11 and item number 12 have to do with the Community Assistance Fund, which, as you know, provides basic human needs to the folks in our community. So these two contracts have to do, they are with Salvation Army. One of the programs is for $62,000 for rental assistance during the winter months. This is a vital program, as you know, with housing and other challenges faced in shelter. So this is a $62,000 for the rental assistance program. And then item number 12 has to do with the emergency transportation program. This is where pretty much the gist of it is bus tickets are provided to people who really are going to a new location to start a better life, you know, with employment or to live with family. So this is a program to assist with that endeavor.
Perfect.
Great. And contrary to what some might think, this program is not just us buying bus tickets for homeless folks and shipping them to Billings or
Really?
something.
That's my favorite rumor.
So, yeah, thanks, Nancy. Glad to see us being able to use our funding in this way. So I would move that we approve items 11 and 12.
Second.
Great. All in favor?
Aye.
Thanks, Nancy.
Okay. Thank you.
Thanks.
All right, on our correspondence. Someone going to talk about our support letter for the Missoula Valley Front Country Access Project.
Yes, hello everyone. This is Kylie Paul with Community and Planning Services Department, Natural Resource Specialist. So this is an opportunity to sign a letter of support that would be supporting the very interesting, cool Missoula Valley Front Country Access Project for a Land and Water Conservation Fund, LWCF funding application. And so the Lolo National Forest is applying for those funds to purchase 18,000 acres, basically of previously Weyerhaeuser land in the Deep Creek area. And so this would help to fund that acquisition, and the Trust for Public Land is helping to facilitate that transaction. And both partners are on the meeting now. If there were questions, you guys did hear from Catherine Schmidt with Trust for Public Land a week or so ago, and Patrick Brittigam is also on the line as well with the Lolo. But this is a good opportunity to sign a letter of support for that project.
One thing I just want to toss out here, I'm really excited about this. I feel like this is the first big step in creating a new vision, bringing a new vision to life. It may take 20 years, but someday there will be 150,000 people living in Missoula County, and the urban area will be a lot larger. And we'll need more recreation areas than we have. And just thinking about the pressure on the PBR right now. And someday Deep Creek will be more than a place you go to burn an appliance or shoot some tires. It'll actually be a place to go mountain biking, hiking, all those other sort of outdoor pursuits. And this is a big step in making that a reality.
And PBR stands for?
Patty Canyon Blue Mountain Rattlesnake. Thank you.
Yeah.
Yeah, absolutely. Typically, when we have discussed this area of Missoula County, it's been in the context of citizen complaints of how to address problems, and I think this is a significant step in the direction of offering not just a Band-Aid solution for problems, but putting us on a path to actually establish a vision for what this area might look like and how it might function in our community.
Someday we'll figure out the road, and the good behavior will displace the bad behavior.
Does Laura or is Martin still on? I can't tell. Does anyone have questions of TPL and Lolo?
No questions as far as what the county's interested in. This is Laura.
Okay.
Great. Yeah, well, we're excited to support this project.
Thanks.
Okay, for discussion items, any board meetings, review of meetings we'd like to talk about?
I can't think of anything.
Okay, any COVID stuff?
We're not going in the right direction.
Yes, that is true. That is true.
So it's friends and family. Take care of yourselves, and because it's sounding like Cindy Farr was saying, it wasn't necessarily businesses or schools that those areas have a handle on it. It's what we do in our private lives and how we conduct ourselves in our private lives that are driving this.
Yeah.
Yeah, do not let your guard down, and do not take the lead of what I witnessed in Wheatland County over the weekend, where there were precious few masks, yeah, not as much social distancing as probably ought to occur. So
I saw good compliance in Fergus County last week.
Ah, okay.
So, yeah. All right, if we got nothing else, we're done.
All right. Thanks, everyone.
All right. Have a good day.